Milan Patel. I am currently pursuing my Masters in Health and Exercise Science at University of Houston Clearly. In this video, I will discuss about the muscle energy technique, how it works, its application on athletes, and the efficacy of the muscle energy technique. Muscle energy technique was designed by Michel Fred to improve musculoskeletal function and reduce pain. Muscle energy technique MET is a form of manual technique which uses muscles own energy in the form of gentle muscular contractions to relax the muscles via autogenic or reciprocal inhibition and lengthens the muscle as compared to the static stretching, which is a passive technique. MET is an active technique in which patient or athlete is also an active participant. Let's talk about how MET works. Lin Chato told that MET is based on the concept of autogenic inhibition and reciprocal inhibition. Autogenic and reciprocal inhibition both occur when certain muscles are inhibited from contracting due to the activation of Golgi tendon organ and the muscle spindles. These two muscular tendinous proprioceptors are located in and around the joints, and muscles respond to changes in their muscle tension and length, which helps in managing the muscular control and muscle coordination. The Golgi tendon organ is situated between the muscle belly and its tendons. It senses increased tension when the muscle contracts or stretches. When the muscle contracts, the Golgi tendon organ is activated and responds by inhibiting the contraction, that is known as reflex inhibition, and along with that it also contracts the antagonist muscle groups. This process is known as autogenic inhibition. The Golgi tendon organ response plays a vital role in flexibility. When the Golgi tendon organ inhibits the agonist muscle's contractions and allows the antagonist muscle to contract more readily, this will produce more stretch and the muscle will be stretched farther and very easier. Autogenic inhibition is often seen during static stretching, such as during a low force long duration stretch. But after 7 to 10 seconds, muscle tension increases and activates the Golgi tendon organ response, which cause the muscle spindle in the stretch muscles to be inhibited temporarily, which makes it possible to stretch the muscle more further. The muscle spindle is located within the muscle belly and stretches along with the muscle itself. When this happens, the muscle spindle is activated and causes a reflexive contraction in the agonist muscle, which is known as stretch reflex. And along with that, there will be relaxation of the antagonist muscle. This process is known as reciprocal inhibition. Based on reciprocal, this concept, MET is divided into two types. That is, one is autogenic inhibition MET, and second is reciprocal inhibition MET. Autogenic inhibition MET is again divided into two types. The one is post isometric relaxation, and the second is post facilitation stretches. Sonakshi Sehgal and her colleagues conducted a randomized controlled trial study on 60 to 30 years of athletes. The subjects were overthrowing athletes with a loss of internal rotation range of motion of less than 80 to 20 degrees with their dominant shoulder as compared to their non-dominant one. The subjects were allocated into the two groups. The group A received MET with hot pack 3 times a week for 2 weeks, whereas the group B received static stretching with a hot pack for the same duration. And then they concluded that MET showed significant improvement in the range of motion and strength of internal rotators in the athletes with the glenohumeral internal rotation deficit. Therefore, this technique can be used in acute cases of posterior shoulder tightness to prevent the occurrence of the other shoulder injuries. Now I am going to demonstrate MET technique for external rotators to increase the internal rotation range of motion in the shoulder joint. For that, the patient should be in supine line with elbow and shoulder flexed at 90 degree with abduction. Now, the therapist has to stabilize the shoulder by placing his hand on the acromion process and the other hand on the distal part of the forearm. Now, patient therapist has to passively rotate the shoulder until the restriction barrier is reached. Then tell the subject to externally rotate the arm with his 20% of maximal effort. Now, please externally rotate your shoulder. 1, 2, 3, 4, 5. Relax. Then again move passively until the new restriction barrier is filled. Again 1, 2, 3, 4, 5. Relax. Again do the same procedure. Externally rotate. 1, 2, 3, 4, 5. Relax. This technique should be performed for the 3 repetitions to achieve the maximum effort result. An immediate effect of MET on posterior shoulder tightness in the basketball player was found in a RCT performed by Moore and team. There were improvements in the glenohumeral joint range of motion, in the horizontal abduction and the internal rotation. Another randomized control trial conducted by Khushbu Bhatia and team on cricket bowlers for assessing effectiveness of muscle energy technique and passive stretching on the posterior shoulder tightness. They concluded that muscle energy technique group had better effects on internal rotation range of motion for improvement, and it also helped in preventing the further injuries. Moreover, there are several evidences available on MET for improving low back strain and hamstring injuries in athletes as well as normal individuals. Now, I will demonstrate the MET for hamstring muscles to improve the flexibility in knee flexion and extension. Now, for that, the patient should be in a supine position with hip and knee at 90-degree flex. Now, therapist should place one hand on the lower end of the femur and other at the lower leg. Now, therapist has to extend the knee passively until the barrier is felt. Now, let's pretend that this is the barrier of his, and therapist has to passively extend the knees, and the subject has to flex his knee. Press it, sir, and hold for the 5 seconds. 1, 2, 3, 4, 5. Relax. Then search for the new barrier. Again, flex your knee. 1, 2, 3, 4, 5. Relax. 1, 2, 3, 4, 5. Relax. So this is the MET technique for the hamstring. Let's talk about the efficacy of the MET. Gary Fryer in 2011 suggests that, like many normal therapeutic approaches, the efficacy and the effectiveness of MET technique are under research, and there is a little evidence to guide practitioners in the choice of the most useful technique variations, such as number of repetitions, strength of contractions, and the duration of the stretch phase, which causes frustration for those endeavoring to integrate relevant evidence into the practice. A limited but growing number of studies shows positive change following the MET interventions. And Gary Frere in 2003 in his second study demonstrate an increase in the extensibility of muscle, and K. Edelman in 1994 told that the spinal range of motion support the rationale of treating the patients or the athletes with reduced mobility, although research involving clinical outcomes are scarce. However, limited evidence exists for the efficacy of muscle energy. The Gary Frere in 2011 suggests that a need to reconsider the clinical diagnostic method and the physiological mechanism causing the therapeutic effect. The mechanism underlying the possible therapeutic effects are largely speculative, but the evidence supports the plausibility of the several modes of the action. There are several indications of MET. MET can be used in healthy individuals to maintain muscle flexibility and to prevent injury. It is also indicated in sciatica, scoliosis, contractures, leg length discrepancy, muscle tightness, and injuries. Greenman in 1989 suggests that MET is contraindicated in pathological conditions until the correct diagnosis has been established.